Hey everyone, in this video I'm going to share the methods that really work for me to interpret the ABG fast while answering NCLEX RN questions. Here I will be discussing about what is ABG, what all are the normal values, what happens when the values varies, how to interpret ABG fast, using the methods, an example to each conditions, and how to recognize the condition with the help of sign and symptoms. So kindly watch the video till the end, and if you are new to my channel, kindly subscribe and press the bell icon so that you won't miss the new contents that are related to NCLEX RN. So let's start. What is ABG? Which is Arterial Blood Gas Test. An arterial blood gas test measures the amount of arterial gases such as oxygen and carbon dioxide in your blood as well as the pH in our blood. Best site to perform ABG test is radial artery and pre-sampling test is Allen's test. It is performed to know the adequacy to radial and ulnar artery, apply the direct pressure to radial or ulnar artery and release the pressure and assess the color of extremity to the distal point and assess whether the rubber color is returning within 6 to 7 seconds. ABG analysis. First we will check whether the pH is normal or out of range. The normal level of pH is 7.35 to 7.45. If the level is below, then it is acidosis. If it is above, then 7.45, it is alkalosis. Then we will check PCO2 level is normal or out of range. PCO2 level is 35 to 45. If the level decreases than 35, it is alkalosis, and the level increases than 45, it is acidosis. Bicarb levels, whether it is normal or out of range. The normal levels of bicarb are 22 to 28. If the levels are lesser than 22, it is acidosis, and if the levels are greater than 28 is alkalosis. There are many methods to interpret ABG, and this is the easiest method that worked for me very well, which is ROM. RO stands for respiratory opposite and ME stands for metabolic equal. Here what happens in respiratory opposite. The directions of both levels will be opposite. When pH level decreases, carbon dioxide level will be increases. When pH level increases, carbon dioxide level will be decreases. And what happens in metabolic equal is the directions of both levels will be in equal directions. Like pH increases, bicarb levels also increases, and when pH decreases, bicarb level also decreases. And now how to know whether the condition is compensated or uncompensated. When the pH level is within normal limits, it is compensated, and when pH levels are increases or decreases, it is uncompensated. Now we will discuss the condition when ABG imbalance occurs. First is compensated respiratory acidosis. In that, pH will be normal and PCO2 will be increases and bicarb level will be just above the normal levels. Next is uncompensated respiratory acidosis, and this pH level will be out of range, PCO2 level will be increases and bicarb level will be normal. Third is compensated respiratory alkalosis, and this pH level will be normal, PCO2 level will be decreased and bicarb level will be below normal. Fourth is uncompensated respiratory alkalosis, and this pH level will be out of range, carbon dioxide level will be decreased and bicarb level will be normal. Next is compensated metabolic acidosis, and this pH level will be normal and both carbon dioxide and bicarb level will be decreased. And next is uncompensated metabolic acidosis, and this pH level will be out of range, carbon dioxide level will be normal and bicarb level will be decreased. Next is compensated metabolic alkalosis, and this pH level will be normal and both carbon dioxide and bicarb levels will be increased. Next is uncompensated metabolic alkalosis. In this, pH level will be out of range, carbon dioxide level will be normal and bicarb level will be increased. Let's check what happens in partially compensated conditions. pH will be out of range, carbon dioxide level will be out of range, and bicarb level will be out of range. Let's do some questions from compensated, uncompensated and partially compensated conditions. Here is the question. pH levels is 7.60, carbon dioxide level is 31 and bicarb level is 25. By using this method, let's see how to solve this. As we have discussed the normal values of pH, carbon dioxide and bicarb, let's check what happened here. Here the pH level is increased, carbon dioxide level is decreased and bicarb level is within the normal limit. Now let's see whether the given pH, carbon dioxide, bicarbs are alkalosis or acidosis. Here values are greater, pH is alkalosis, carbon dioxide is lesser, alkalosis, and bicarb level is 25, which is within the normal limit, and that is also alkalosis. Now let's check the condition is compensated or uncompensated. Here pH value is 7.60, which is greater than the normal limit, which is uncompensated. Now using Rom's method, let's check the condition is respiratory or metabolic. Here the pH value is against or opposite direction of carbon dioxide, which is pH is increased and carbon dioxide level is decreased. So it is respiratory, and most of the values are going towards alkalosis, so it is alkalosis. So here the condition is uncompensated respiratory alkalosis. Now this is an example for compensated respiratory alkalosis. Here pH value is 7.44, which is within the normal limit, and it is alkalosis. Carbon dioxide level is 28, which is lesser, which is alkalosis. Bicarb level is 18, which is decreased than the normal limit, and it is acidosis. Here pH is within the normal limit, so it is compensated, and pH and carbon dioxide level is opposite direction, so it is respiratory, and most of the values are towards alkalosis, so it is alkalosis. So the condition here is compensated respiratory alkalosis. Here is the example for partially compensated metabolic acidosis. Let's check the values. pH is 7.05, carbon dioxide is 23, bicarb is 12. All of the ranges are out of the range, so it is partially compensated. By using Rom's method, let's check the situation or condition is metabolic or respiratory. Here the pH value and bicarb level is moving to same direction, so it is metabolic. And most of the values are moving towards acidosis, so it is acidosis. So here the condition is partially compensated metabolic acidosis. So here is the question for you to solve. What will be the condition when pH levels are 7.10, PCO2 level is 68 and bicarb is 32? Kindly interpret this ABG values and comment below. Now we will discuss signs and symptoms that commonly occurs in acidosis and alkalosis. What happens in acidosis? When potassium moves out of the cell, hydrogen ions moves into the cell. That leads to hyperkalemia. Rest of the signs and symptoms are bradycardia, headache, hyporeflexia, cusimal respiration, paralytic illness, and coma. Now let's see what happens in alkalosis. When potassium moves into the cell, hydrogen ions moves out of the cell, which leads to hypokalemia. Decreased hydrogen ions and decreased concentration of calcium ions leads to hypocalcemia, which leads to tetany. Rest of the signs and symptoms are tachycardia, irritability, tachypnea, hyperreflex. I hope you all like this video. Kindly like, comment, share and subscribe my channel.